As many as 700,000 Americans are believed to be affected by UC, and the disease has a tendency to be hereditary. In fact, up to 20% of those diagnosed will have a close relative who is also affected by UC. Men and women appear to be affected equally. However, men tend to be diagnosed a little later in life than women. The symptoms of UC vary from person to person and are generally related to where the inflammation occurs within the colon. There are several types of UC that we should be aware of. The first is ulcerative proctitis, which, as the name implies, involves just the rectum. There's also proctosigmoiditis, which includes the rectum as well as the sigmoid part of the colon. There's left-sided colitis, which is inflammation that is involving the entire side of the left colon up to the splenic flexure, and then of course pancolitis, which is usually a more severe form of ulcerative colitis, and that includes the entire length of the colon. And then there's pancolitis, which involves the entire length of the colon and is generally associated with more moderate to severe ulcerative colitis. The symptoms associated with ulcerative colitis vary from person to person depending on the severity of the inflammation and where it occurs. Some common symptoms may include abdominal pain, periodic diarrhea, loosened stool, loss of appetite, fever, weight loss, anemia, and of course rectal bleeding. It is the inflammation of the lining of the colon that causes painful symptoms that are commonly associated with ulcerative colitis. Inflammation causes the large intestine to empty frequently, causing diarrhea, and because of the open ulcers, may also at times be bloody.